ሰላም ጤና ይስጥልኝ ውድ የከዚህም ከዚያም ዩቲዩብ ቻናል ተከታታዮች በቻይና ሀገር ውሃን በተባለች ከተማ ከእንስሳ ወደ ሰው የተላለፈው አስደንጋጭ ቫይረስ በአስደንጋጭ ፍጥነት ወደ ሌሎች ከተማዎች እየተሰራጨ እንደሆነ የቻይኒዝ አውቶሪቲስ እየተናገሩ ነው። ይህ በሽታ ወይም ቫይረስ ኮሮና ቫይረስ በመባል የሚታወቅ ሲሆን በመጀመሪያ ውሃን በተባለችው የቻይና ከተማ ባሳለፍነው ዓመት መጨረሻ የታየ ሲሆን አሁን ደግሞ ወደ ሳውዝ ኮሪያ፣ ጃፓን እና ታይላንድ ከቁጥጥር ውጪ በሆነ ሁኔታ እየተስፋፋ እንደሆነ የተለያዩ ታላላቅ ሚዲያዎች ይዘግባሉ።
The number of cases has gone from a few dozen last week to nearly 300 now, and health officials have confirmed that the virus can spread from person to person.
At least 14 healthcare workers in China have now contracted the virus after treating infected patients. At least 6 people have died, and the number of confirmed cases has quadrupled to nearly 300. And it's not just China. Take a look. Since the virus first appeared in the central Chinese city of Wuhan last month, it has spread into neighboring countries like Japan, Thailand, and South Korea. Back in the States, the CDC screening thousands of passengers arriving from Wuhan at JFK, LAX, and SFO. Officials checking temperatures, looking for symptoms similar to the common cold, flu, or even pneumonia as travelers enter the country. At this train station in Hong Kong, passengers getting screened for the virus right off the train. Our Bob Woodruff speaking to one American tourist at the station who decided to cut his visit short.
Is it kind of frightening at all to you that this is starting to spread?
Oh yes, of course, that's why I'm going home.
Oh, how worried should people be here in the U.S.?
Listen, we have to emphasize this is a dynamic and evolving situation. U.S. public health officials are still saying that the risk to the U.S. population is low, but we have to be clear. We don't yet know how this virus spreads. We know it can be passed human to human, but we don't know how, and we don't know how severe it is. We're going to be looking for the mortality rate or the death rate with this.
Or they actually start to develop symptoms. So with this gentleman, for example, we know that he's in a...
ይህ ቫይረስ ዩኤስ አሜሪካ ላይ ምን ስጋት ሊያደርስ ይችላል የሚለው ጥያቄ ሆኖ ለቀናት ቢቆይም ሳምንት ሳይቆይ ማለትም በዛሬው ዕለት ሲኤንኤን እንደዘገበው የመጀመሪያው አሜሪካዊ ተጠቂ በአሜሪካ ከተማ ዋሽንግተን ዲሲ ላይ ሲያትል ከተማ ውስጥ እንደተገኘም ተረጋግጧል። ዋነኛዎቹ የቫይረሱ ተጠቂ ምልክቶች የመተንፈስ ችግር፣ ትኩሳትና ሳል ሲሆን ይህም ለተለያዩ ማለትም ለውስጥ አካል መጠቃት፣ ኒሞኒያ እንዲሁም ለሞት እስከሚያደርስ ድረስ የሚያጠቃ መሆኑን የጤና ባለሙያዎች ይናገራሉ። ለዚህ ቫይረስ እስካሁን የተገኘ መድኃኒት ወይም ክትባት የሌለ ሲሆን ብቸኛው አማራጭ ፕሪቬንሽን ወይም እንዳይሰራጭ መቆጣጠር መሞከር ብቻ ነው። በአሁኑ ሰዓት በውሃን ከተማ በመቶዎች የሚቆጠሩ ነዋሪዎች የተጠቁ ሲሆን በከፍተኛ ሁኔታ ሆስፒታሎችና የጤና አገልግሎት ሰጪ ቦታዎች ተጨናንቀው ይገኛሉ። የትራንስፖርት አገልግሎቶች እንደ ባቡር ጣቢያ እና እንደ ኤርፖርት የመሳሰሉት በዛሬው ዕለት እንደሚዘጉና አገልግሎት እንደማይሰጡ የተነገረ ሲሆን መቼ ተመልሰው እንደሚከፈቱ የተነገረ ምንም ነገር የለም። ውሃን ከተማ ላይ የሚገኘው የኤርፖርት ወደ ለንደን፣ ፓሪስ እና ዱባይ እንዲሁም ወደ ተለያዩ ከተማዎች ከ24 ሚሊዮን በላይ የሚሆኑ መንገደኞችን የሚያጓጉዝ ትልቅ ኤርፖርት ነው። ዛሬ ጃንዋሪ 22 2020 ማታ ላይ የሚያርፈው ከዩኬ የሚነሳው ፕሌን ለመጨረሻ ጊዜ ውሃ ኤርፖርት ላይ የሚያርፍ መሆኑን ተገልጿል። የወርልድ ሄልዝ ኦርጋናይዜሽን ወይም WHO በዚህ ጉዳይ ላይ ግልጽ የሆነ መረጃ ለመስጠት እየሰራ ሲሆን የWHO ዳይሬክተር ዶክተር ቴዎድሮስ አድሃኖም በዚህ ዕለት በሰጡት መግለጫ በዚህ ቫይረስ ዙሪያ በነገው ዕለት ከተወያዩ በኋላ ለግሎባል ሄልዝ ኢመርጀንሲ በአስቸኳይ እንደሚያሳውቁ ተናግረዋል። ይህንኑ የሚያሳይ ቪዲዮ እንመልከትና ለዛሬው በዚሁ እንሰነባበት። ሰላም ሁኑ።
It's a big presence of journalists there. That's when our great colleagues say, "Ooh la la." Moist.
Voice.
Good evening again, and thank you very much for your patience.
Voice. No voice. Voice.
We don't have any song.
Can you hear us well now?
Okay.
That's okay. Good evening again to everyone, and thank you very much for your patience, for bearing with us for the last hour and a half, almost 2 hours. Thanks also to all journalists who are online. I understand we have more than 150 journalists who are watching us and listening to us right now, either by dialing in or by watching us on WHO Twitter and WHO Facebook account. We are late, so I will just keep it short. For those online who would like to ask questions, please dial 01 on your keypad and you will be put in the queue. As we have announced earlier, and you have the nameplates here with us, we have Dr. Tedros, WHO Director General, Professor Didier Houssin, who is chair of the emergency committee. We have Dr. Mike Ryan, and we have Dr. Maria Van Kerkhove from Department of Diseases and Zoonosis Unit. Mike Ryan is the head of emergencies at WHO. You know, today was the first meeting of the emergency committee under international health regulations on novel coronavirus, and I will give the floor immediately to Dr. Tedros.
Thank you, Tariq. And good evening to everyone in the room and everyone online. We're really sorry that we're late, but thank you all for your patience. As you know, this is an evolving and complex situation. And I would like to thank Dr. Houssin for his leadership of the emergency committee and all members of the committee, the advisors, and those who made presentations earlier today during the deliberation. I was very impressed by the detail and depth of China's presentation. I also appreciate the cooperation of China's Minister of Health, who I have spoken with directly during the last few days and weeks. His leadership and the intervention of President Xi and Premier Li have been invaluable, and I know you're following the actions they are taking. All the measures they have taken to respond to the outbreak. Today, there was an excellent discussion during committee meeting, but it was also clear that to proceed, we need more information. For that reason, I have decided to ask the emergency committee to meet again tomorrow to continue their discussion. And the chair, Dr. Houssin, has agreed with that request. The decision about whether or not to declare a public health emergency of international concern is one I take extremely seriously, and one I'm only prepared to make with appropriate consideration of all the evidence. Our team is on the ground in China as we speak, working with local experts and officials to investigate the outbreak and get more information. We will have much more to say tomorrow, and thank you very much, and we'll be glad to answer any questions you have. But before that, I will give a chance to the chair, Dr. Houssin, to say a few words, and after that, Mike to have to say on the actions we have recommended. Thank you.
Thank you very much, Dr. Tedros, and thank you for you all to be present this evening. It's true that the committee met during several hours today. We heard very interesting report from the Republic of China about the situation in China. We also heard reports about the situation in Japan, in Thailand, and in Korea. Following this, we had also the analysis of the situation made by WHO Secretariat, and then we entered into a discussion about important advice to provide to the DG of WHO That is the situation corresponding to a public health emergency of international concern, and what advices should be given to the DG. The views of the members of the committee, considering the information provided, was split about the opportunity to advise the creation, the decision of a fake. But we formulated a series of recommendations concerning the improvement of containment and mitigation measures, which are already important in China, and also about the measure that should be taken by member states. One of these measures is the improvement of sharing of information and cooperation between member states in such a situation. One of our advices was to suggest to the DG that the emergency committee should be reconvened very early if necessary. And in fact, the situation is evolving rapidly, as said Dr. Tedros, and for this reason we of course agree completely with his decision to reconvene the committee tomorrow, considering the evolution of the situation and the measures taken not noticeably in China. Thank you.